Today on Facebook Live, I'm Dr. Shilpi Reddy, Head of the Department, Cuddles, Mother and Child Center, Kondapur, Hyderabad. We're going to talk about simple lifestyle changes for a happy and healthy pregnancy. A planned pregnancy is always a better pregnancy, is what all the doctors say. Because if you can plan your pregnancy, definitely you can alter your lifestyle issues, alter your whatever problems that you have, and then have a very peaceful pregnancy. Along with it, if you have a planned pregnancy, definitely your nutritional status, your general body status also is more, you're more aware of such things. In that context, anybody who is planning pregnancy definitely should look in for a very good prenatal visit, that is preconceptional visit. Preconceptional visit to a doctor is mandatory to check whether you are having any issues in terms of very common anemias. You have any issues with any of your sugars, your thyroid levels, you can have a screening for rubella. So all these things will give an insight into your health. That is more important. Anybody who's planning pregnancy should not suffer with anemia, should not have uncontrolled sugars, should not have uncontrolled hypertension, should not be very obese, that is BMI more than 30. If possible, definitely decrease especially the excess weight, because it gives a lot of risk factors at a later date. If your sugars and BP are not very well controlled on medications, you have to control them. If you are having any history of epilepsy or thyroid or any other issues in terms of health problems, definitely you have to look into controlling these parameters before even planning pregnancy. Your TSH level should be less than 2.5. Your anti-epileptic drugs should be on the safer zone. You should be on safer anti-epileptic drugs, or any drug for that matter. Even for some people have migraines, some people have health issues, some people have renal issues, some people have liver issues, some people have cardiac issues. If they are on any such medications, you should definitely titrate them to a safer drug, which is more relevant to the current pregnancy that they're planning on. And we are talking always about a planned pregnancy because if you have any other medical problems or any related things, you can control them well in advance, which will obviously decrease the risk factors in pregnancy that you're going to have. That is one thing. And you should always look into the aspect of vitamin supplementation. Nowadays, most of them are vitamin D deficient. So vitamin D deficiency is the most important deficiency that we are having. So vitamin D deficiency should be covered. You need not check your vitamin D levels, because if you know that you are always indoors, you're not going outdoors, you will have an insight into the deficiency that can be there because of lack of sun exposure. So definitely you can have your vitamin D supplements. Your folic acid supplement is very, very important to decrease the risk of congenital abnormalities in pregnancy and the fetus. So that is very important. And somebody who's planning pregnancy after 30-35 years, you will need antioxidants, you will need special medications depending on what nutritional deficiencies you have. Some people have constant iron deficiency, they have constant B12 deficiencies. Some people have zinc deficiency, some people have magnesium deficiencies. Depending on what symptoms that they carry, those kind of deficiencies have to be controlled and very well handled before planning pregnancy. A very low vitamin D level is also not good, and any metabolic problems have to be definitely controlled. So with all these things, these are medically related. Any medical conditions, any vitamin conditions are all medically related. But they have a grassroots level why they have even appeared for somebody who's planning pregnancy. So pregnancy age groups definitely are not diabetic age groups, not hypertensive age groups, but there is some kind of a problem that women are facing these days because of lifestyle issues. There is a rapid rise in obesity, there is rapid rise in polycystic ovaries, there is a rapid rise in hypertension, metabolic problems, we have innumerable problems because of lifestyle. That is what has to be addressed. It is not only about the medicine and the medicinal purposes and the metabolic parameters that you need to look into. You always have to look into beyond the medicine and science. You have to look into the aspects of general well-being, the aspect of your lifestyle, the aspect of your physical, endurance, your mental endurance, your psychological endurance. That is why, beforehand, they have defined health as complete balance of physical, mental, psychological, and emotional well-being. And it's just not the absence of a disease or infirmity. So anybody who's planning pregnancy has to look into those aspects. Those are very, very important because you just can't, have folic acid and you just can't have your vitamin D and you think that you're all good. You might be having obesity related issues, you might be having psychological issues, you might be having any other problems related to health. So when you have to think about pregnancy, you need to look into small simple lifestyle changes that will make your pregnancy and your child rearing a very beautiful journey that you can remember your lifelong. So what changes that I usually recommend my pregnant women? So it the day starts with small things that you can do to improve your health. Be it honey like water, a few yards of walking, or your pranayama, or your meditation, or you can have the Surya Namaskars, or anything for that matter to improve your fitness levels. Charge your day with having lots of water and start your day with some kind of an exercise. That makes a lot of difference for the whole day. It improves your oxygenation, it improves your attentivity, it improves your physical endurance, it gives that wow feeling. You have a lot of happiness quotient running in the whole day. You're more active, you're more charged, you're more happy, and you have that kick like feeling the whole day because you have done something in the morning that has improved your overall metabolic parameters. So anybody who has the start off with the day have lots of water. It can be honey water, it can be lime water, it can be warm water, it can be some kind of an oil pulling, or it can be any practice that gives you that kind of confidence and well-being. There are people who have vinegar, the apple cider vinegar people. There are people who have just honey in the morning. There are people who have nuts in the morning. There are people who have milk in the morning. So whatever gives you that charging point to just break that the whole night fast, take that and start your day with exercise. Exercise can be walking, meditation, pranayama, as I've told you, or Surya Namaskar, or Pilates, or anything for that matter. There are people who do kickboxing, there are people who do all these things. There are people who do rope exercises, there are people who do treadmills, cross trainer, CrossFit, anything for that matter, until and unless you're pregnant and there is a contraindication, you can do whatever kind of an exercise that starts your day off. So you can, once your exercise is finished, then you should have complete good breakfast. Breakfast is really, really nutritious. It is important for the day. It gives you the charge for the day. There's so many people nowadays who have work late in the night. They don't get up in the morning. They skip their breakfast. They have health issues and metabolic issues and all that. This is one of the common reasons why we are having obesity, why PCOD weight is not coming down. There are many more things to it because as your body, we have to think about the normalcy. The whole life from childhood, you had a practice of having, getting up on time, during school days, getting up on time, morning some exercise, and going to school, and having breakfast and going to school, regular eating habits, physical exercise, come back and you have lots of time to play. All these things are getting broken, and there is a different kind of practice that has been getting into your lifestyle, like sleeping sleeping late night, getting up late in the morning, skipping breakfast, no exercise, all these things. They bring a lot of bad, culture into the system. This is one of the major sources for hormone imbalance because in the midnight, when you're in deep sleep, say if you sleep at 10 o'clock and if it is 1:30 or 2 o'clock in the midnight, that is when the growth hormone releases in the body, which is the most important hormone to regulate all other hormones of the body. So that hormone, if it is not released, it's pulsatile releasing hormone. If it does not release on time, it gives a scope for a lot of hormonal irregularities, lot of ill health, lot of weight gain, a lot of negative metabolism that is happening in the body, and it is one of the root causes for obesity, one of the root causes for multiple problems that come into the system. So regular sleeping time is very important, and get up as soon as possible. Do your daily routine, have healthy breakfast. You can have anything in your breakfast because if you can live the day or the whole of the day on breakfast, you can burn it. So basically, you can be a little liberal and you should have a nutritious breakfast. Breakfast, not the westernized breakfast. If you can have your Indian social, cultural, what your ancestors had, what your parents had, the cultural, lineage is there. If you can have the same kind of food, you're less likely to have obesity. That is what the trend says. So people who have dal chawal, you can have a dal chawal roti sabji. People who have idli, upma, dosa, poha, all these things, you can have those. So it depends on what social background that you have. Your breakfast has to be in that way. You just can't have cornflakes and say that you have a healthy breakfast. That is not correct. Anything in the boxes is not good, it's not healthy. It is not for people who are planning pregnancy, that's for sure. And once you have your breakfast, you can get back to your work and you can do everything, whatever your work schedule is, whatever is demanded of you for the whole day. But have small snacks that keeps you charged up. It cut down on the obesity risk because when your body is getting food on a regular basis, it does not store fat. That is very, very important. And when you're eating small quantities more frequently, mostly protein sources, you're likely to lose weight also. And your insulin sensitivity also improves. This helps for people in PCOD and obesity where you have a regular small protein meal pattern. Definitely you will have weight loss and you will have your BMI targets which can be achieved easily. Not only this, whatever that you're having, please look into the aspect of the nutritious content of that product, what you're eating. You can have your daily routine normal food, just look into the content of protein. Most of us look into the calorie part, and calories is what we have enough, but what lacks in our diet is protein. Protein, it is very, very important. 1 milligram per kg body weight protein is really important. And for somebody who's pregnant, it is 1.5 milligrams per kg body weight protein that you eat on a regular basis daily. So it is important that you should look into the aspect of protein intake. So a lot of pulses, legumes, nuts, eggs, or anybody who's vegetarian, you can have your milk and milk products, paneer, tofu, you have mushrooms, you have so many vegetables which are high in protein, lots of green leafy vegetables you can have. You can have all pulses and legumes and sprouts. All these have a very good source of proteins. Nuts, pecan nuts, anything. Even peanuts are very good source of protein. You can just live on peanuts and they're very, very healthy. So all these things matter a lot. The amount of protein that you're taking definitely is proportional to your health and its level of your level of obesity or your level of fitness and BMIs. It definitely reflects that. And one more aspect of diet that I really need to stress on is regular food, yes. Protein diet, yes. Lose excess weight, yes. And early dinner, yes. No skipping breakfast is yes. And one more thing is please cut down on Western diet. That means which is not your social diet. It can be pasta, pizza, or it can be fries, or it can be KFC chickens or Domino's or anything of that matter. Those are definitely no for someone who's planning pregnancy because they have a lot of preservatives, they have a lot of additives, they have a lot of addicting forming substances. They are stored under what conditions we are not very clear. and definitely they are not good because they have been made by things which have been stored for a very long time. Definitely not healthy. What if you want, if you're hungry, if you're repeatedly hungry, you can have fruits, you can have your vegetables, you can have your nuts. All these things are easily available without cooking. That's very important. And make sure the source of food is tracked. That means I still prefer for somebody who's having plans of pregnancy, definitely they shift over to organic food. Organic food is something that decreases the amount of fertilizers that we are taking, the amount of the excess chemicals and pesticides that we are taking. All fertilizers, pesticides, and chemicals associated with food decrease fertility levels. They get into the under functioning of placenta. They get into a lot of problems in pregnancy also. So definitely a very yes for organic food. Organic food not only nutritionally it is much good, it does not give that anti-element to the body. And the more organic food that you eat on a regular basis, whatever chemicals, fertilizers, pesticides that are there in your body slowly are getting cleaned up by your system by themselves. That improves fertility rate and also improves the egg quality and sperm quality. So it is not only about women that I'm talking about men also. As far as women's egg quality is concerned, equally important is the sperm quality, which is rapidly decreasing in the current situation. So organic food, yes. Regular food pattern, yes. Small meal pattern, yes. Protein food, yes. And make sure quality of food is met. That is really important. Eat fresh, don't eat preserved food, don't eat recooked, reheated food. That's important. Preserved food has a loss in its vitamins and nutritional level. So eat fresh, eat colored vegetables, eat your oranges, fruits, beets, carrots, spinach, capsicums. All these are rich in color. So these colors have a lot of antioxidants, and antioxidants have a very good role on egg and the sperm quality and pregnancy rates. So eat a lot of colored foods, be it fruits or vegetables. They're very healthy. And along with these, look into the aspect of the quality. You have everybody says it's organic food, but yes, certifications of food make a lot of difference. Anybody and anywhere you are getting organic food, you should definitely check into the source of food. That's very important. And it is not about only vegetables and fruits that are organic. Even the spices you have organic now. Even the whatever food that you eat, even the wheat, your flours are organic now, millets are organic now, rice is organic now, fruits, vegetable pulses, everything is organically available now. Just look into the certification aspect and buy from a genuine source. So genuine sources are really important. So these kind of lifestyle changes go a long way. So what have we talked about is, first thing, the exercise part. The first thing is the preconceptional visit, diagnosis of all your pre-existing illnesses, making arrangements for shifting to safe medications, vitamin supplementations, then your diet aspect, then your aspect of having nutritionally good diet, your exercises. All these things make a lot of difference, especially for somebody who's planning pregnancy. They are looking forward for somebody else coming into their life, a small life that is coming into their life. Once their pattern of life is settled, they obviously will give the same pattern of healthy life to the coming baby. So it's very important. And one more thing I wanted to emphasize on the diet aspect is, please do cut down on free sugars, simple sugars, and the ones that will give immediate rise in the blood glucose levels, like the colas, the Pepsis, the caffeinated drinks, the zero sugar drinks, the fresh fruit, the juices, the canned juices or whatever. Eat fresh fruit. It has got a lot of fiber and nutritional level is maintained. Rather than having juice, fruit and fiber is important. Nowadays there are a lot of food processors which even give the fiber part, so you can look into that also. And chewing and eating food definitely gives a lot of nutritional value and assimilation value and a lot of package and fiber that helps people who have constipation. So that is one more thing that you have to regulate your system. People with lifestyle problems like constipation or irritable bowel syndrome, or recurrent headaches, recurrent body pains, joint pains, look into what has caused the reason. You should look into the reason what has caused this problem. Usually it is inflammatory food. Usually it is the pesticides that come through it. Usually it is due to lack of protein and natural vitamins. So when we supplement with dates or dry fruits like the nuts and all the some value added pre-soaked nuts. Nuts can be anything. It can be sunflower seeds, it can be watermelon seeds, it can be pecan nuts, it can be wild berry nuts, it can be almonds, walnuts, it can be the cashew nuts, it can be peanuts, anything. Nuts have a lot of vitamins and natural sources of omega fatty acids and natural sources of oils that give healing capacity to all these pre-existing illnesses. So you should recognize the symptoms and identify the solution for that symptom and then rectify it with dietary pattern. So once your diet is all set, your system is all set. When your system is set, definitely pregnancy is going to be very, very good. Not only that, the growing child will get that nutritional level. The growing child will be pure, not infected by pesticides and fertilizers and all these things. The child who is born will be more in terms of immunity level. They will have a very good systemic capacity and they will grow into a better individual because your lifestyle is already set. They will also get the right amount of nutrition, the right method, the right way. So all these things matter. So once we have completed all these things, the next comes is the sleep pattern. What I have to talk about sleep pattern is your healthy sleep pattern, the 8 hour or 9 hours of sleep, is definitely important. And this kind of sleep pattern helps a lot. Once your sleep pattern is all set, you will have no issues with hormones. So, at least 8 to 10 hours of sleep is very, very important. Uh, at least, if not 8 hours, 6 to 8 hours is definitely beneficial. And once your sleep pattern is all set, the hormones do function very well. That is one thing about sleep. And sleep is something that you cannot ignore because you're very irritable, you're very, not present with mind when you're not sleeping well. And that is one more thing why we have hormonal imbalances these days. Sleep pattern is really, really important. Along with sleep pattern, we also have to talk about very important things like gadgets. Yes, gadgets are something that are causing a lot of lifestyle issues. It can be gadget addiction, it can be time that we are spending on the gadgets, it can be radiation, it can be effect on the eye, it can be effect on because of the blue light effect on the sleep pattern, your melatonin levels, all these impact a lot. And when you're looking for something like pregnancy and responsibilities in future, you cannot have gadget addiction and you cannot have social media addiction because those are the things that we need to really wean off because mothers nowadays are getting addicted to that and once the baby comes in they don't have time for these things, they're getting irritated, they're getting frustrated over things that my personal space, my personal life is all gone and all these kind of psychological things are coming in. So it is very, very important that gadget addiction does not happen. And gadget addiction is something that has a lot of more implications than what you're thinking about. It is taking away the quality time that you have to rectify yourself, or streamline yourself, or spend the me time is gone into some gadgets and some unwanted information, and it is so addictive that people go into that and to come out of it is very difficult. And people are even stopping to sleep and overnight they're looking into the gadgets and playing games and seeing a lot of unwanted material which is really not required. So when you're looking into pregnancy, childbirth and responsibilities and something really related to the positivity of becoming a parent, definitely gadget addiction is something that you have to wean off and look into only the correct content and the minimalistic use of gadgets, which is really, really important, and you should look into that. Otherwise, gadget addiction is something not really, really good. After that, talking about gadget addiction, there are other, compulsive disorders like using harsh perfumes or using harsh chemicals in the body in the form of cosmetics or using chemicals in the form of shampoos or body creams and all that. Definitely, you have to shift from these toxic, chemical products to non-toxic products which are naturally available. You can use oils for lubrication. I mean, for moisturization. You can use the normal, the petroleum jelly for, the cracked feet or something like that. And natural products in the form of lipsticks or natural products in the form of anything that goes into the eye or anything for that matter, because body skin is a huge organ, and it takes good, bad, ugly also. So whatever goes through your skin, definitely you have a control on that. So look into something. Do not use a lot of toxic products, a lot of harsh cosmetics that have a lot of implications in the future, and cut down on products that have lead, mica in them, cut down on products that have plastics in them. Recently, there is research saying that there has been plastic and plastic products that have been identified in human placenta. This is too much to talk about, and where plastic has reached into a safe zone where nothing should reach is definitely a question. Because in Rome, apparently, doctors have found when they checked random placentas, uh, they could find plastic pieces in the placenta. Plastic must have reached there through the products that people use. So if placenta is also having plastic, how safe is the baby? We don't know. So definitely cut down on plastic, because plastic is something that is really, really taking the toll on the whole world. So use bags that are reusable. Carry your bags. Carry wherever you are going. Cut down on plastic bags, plastic things. Use glass bottles. Do not use plastic anywhere that you're using. Anything that you have to heat or cook, use utensils that are very friendly. Like you can use cast iron utensils. Those are very, very friendly. And they give the iron content also into the body. Do not use coated or, the non-stick coated vessels, because non-stick coated vessels also have poisonous ingredients in them. So these are small things that definitely make a lot of difference in women's life, because they are leading the family. They are the ones that everybody looks forward to. And men also these days have to be equally, equally positive in handling themselves. They should also change their habits. Absolutely no to smoking and no to alcohol, because this is one thing. And alcohol, smoking, and substance abuse is something that is causing a lot of infertility issues, a lot of miscarriages in pregnancies. And passive smoking is also very hazardous. So it does not mean that you are not smoking and somebody else in the house is smoking, you will not be affected. Definitely, passive smoking is also an issue. You have to give up on smoking tobacco products. You have to give up on alcohol. You have to give up on binge drinking. You have to give up on substance abuse. All these things matter a lot. So small changes that really, really impact on the quality of egg and sperm are important. So today we have covered many topics that you might know, you might not know. Definitely, all these things matter a lot, and small changes in lifestyle, small changes in the pre-pregnancy period itself will go a long way, because you have to have a healthy habit formation. Once your habit is formed, then it comes to the entire life. So we're just looking in for any questions that are there. So any questions, it will reflect here. Any questions? They come to my listening. Okay, I hope there are no questions, quite clear. So definitely we have another round of new topic discussion the next time. Thank you.